Hello, my name is Dr. J Mocco. I'm the director of the Cerebrovascular Center here at Mount Sinai, and I'm very excited today to share a case with you that highlights the evolution of endovascular techniques and technology to help treat patients with brain aneurysms and other complex brain vascular abnormalities. This is a case where a woman had an aneurysm that didn't have the right kind of tools to be able to treat when she was first discovered, but eventually she came under our care. Uh, Care and technology evolved over time, and it provided us with an opportunity to help her and cure her aneurysm. Briefly, by way of starting, these are my disclosures. I don't think any of them are relevant to this talk or touch on any of the talk's details. This is a 70-year-old woman who had an aneurysm in an area called the basilar tip, which is at the back base of the brain. It was originally discovered in 2013. It was nominally measured at 2.4, but as you can see, it was really just measured in its height and not the entire length of the aneurysm from front to back. And at that time, the doctors who saw her said that they recommended non-invasive surveillance or to watch the aneurysm to make sure that it wasn't getting different or more dangerous or larger. Here's the picture. If you look at it, you can see they've really just measured this area here, have not measured the additional second lobe that's posterior. Um, and then you can see on the AP, there's a larger lobe forward and a smaller lobe posterior here. But in any case, this was reasonable guidance and information, particularly with the technology at the time, and so she was observed. In 2024, we did an evaluation of her aneurysm with a test called an MRA. It's a non-invasive procedure. And you can see on the MRA, you still see these two different lobes that are quite noticeable. However, on discussion of this, and with the development of softer stents, more navigable stents that are able to be brought through smaller catheters, and softer and more flexible coils that can easily move along an irregular aneurysm shape like this, we felt after discussing in a multidisciplinary cerebrovascular conference with expert neurologists, radiologists, and neurosurgeons, we all felt this was a reasonable aneurysm to treat that also carried a reasonable risk. And the measurements that we performed prior to the embolization, you can see that the aneurysm measured almost 7 millimeters, which puts it at a pretty high risk category for potential rupture for this woman, particularly given its location at the basilar tip. Once again, you can see it's got a very irregular long structure. This is the front, here's the back, or there's a picture more from the front. You can see one lobe in the front and one lobe in the back. So based on this, we decided to treat her. We went through her wrist with a small catheter in her wrist to then go up the vertebral artery, the artery in the back that goes up to the basilar artery. And we used two very small catheters that are less than 17 thousandths of an inch in their lumen. They're very soft and very navigable. We brought this up in position, and here you can see, once again, the two lobes of the aneurysm. And now the catheter that's delivering the stent in one branch here. The catheter is going to coil the aneurysm is right down here. This was able to be effected with excellent placement. We used a Neuriform Atlas stent, a type of stent that wasn't available in 2013. Very soft. In fact, the brand name is Silky Soft Coil. That's made in Japan and also was not available, at least in here in the US in 2013, to affect the treatment of this aneurysm. Now, here's a great picture that shows the coils going into the aneurysm in the front and in the back, obliterating it. And you can see the little markers for the stent, keeping the aneurysm neck well protected. Here's a short video, which will sort of highlight for you the process as we slowly advance the coil into the aneurysm. You can see it's going into that back lobe right there, filling up the region just like that and getting excellent coverage. And here's a subsequent video as we put in further coils to do exactly that. Here's further videos. We got closer to complete obliteration. You can see nice darkness from the coils filling up the aneurysm from both the front view and the back view. And then here's the initial result, which looks quite excellent with excellent occlusion and no signs of any bleeding or any clots forming or anything negative. We also take a picture of the artery as we're leaving that we used to get up there. So out here is the wrist, way out here. And then this is the artery to the arm. Here's the collarbone right here. And then we go up this twisty artery up here to get all the way to that aneurysm that's up in the brain. And this is the initial result, which shows very excellent coil placement and excellent stent placement. More importantly, she did wonderfully clinically, and she came back at about 3 months later. And you can see here now complete obliteration of the aneurysm. There's no hint of any aneurysm left. Likewise, this is a lateral oblique. You can see complete obliteration of the aneurysm. This is not the aneurysm. This is the branch of this artery making a turn right there, in case you're wondering. And so this is just a comparison before the aneurysm on your left and after embolization, the aneurysm has gone on your right. Or in this picture, you can see before on your left, the full aneurysm bilobed front and back, to afterwards with complete coverage of the dome and obliteration of the larger front dome and the smaller posterior dome. Well, I hope you found that case interesting. We're very happy we were able to help that woman, and we look forward to future opportunities to share extremely interesting cases about where the future of medicine is going. Thank you very much.